A bewildering array of prostatic urethral stents is available. Many have been withdrawn from use. The current status is that they could be used for short-term management or long-term management in patients not fit for surgery. Microwave thermotherapy uses microwave energy to produce temperatures of 45 to 60 degrees centigrade in the transitional zone, at the same time cooling the urothelium using a cool jacket around the catheter. Although the equipment is expensive, good results have been demonstrated in various studies. Nd:YAG laser with a right angle fiber. The tissues could either be coagulated or vaporized. There is less bleeding and fewer complications, but the procedure is time consuming and expensive. Needle electro-delivered radiofrequency or TUNA creates temperatures about 60 degrees to 100 degrees centigrade during treatment and produces coagulation necrosis. It is such a minimally invasive procedure that some centers do not place catheter in the postoperative period. However, 20 to 40% incidence of urinary retention have been reported. TURP, or the electrosurgical resection, now remains the gold standard for comparison of surgical treatment. This technique uses a resection loop and electrosurgical generator, delivering cutting and coagulating current. The disadvantages are that there is bleeding and absorption of water or glycine that is used, causing dilutional hyponatremia. The relative risk for death is about 1.45 up to 5 years, and the procedure carries a mortality of about 2.5%. These figures form a large multicentric study in the late 80s and have probably changed now. TVP, or transurethral vaporization of prostate, uses the familiar electrosurgical technology and maneuvers, but uses a much higher power to vaporize the prostate. There is hardly any bleeding or dilutional hyponatremia. The limiting factor is the size of the prostate and is ideal for smaller glands. TUIP, or transurethral incision of the bladder neck, is applicable for small prostates, and the results are comparable to that of TURP. This uses the electrosurgical technique and a straight blade called Collins knife. High intensity focused ultrasound is a form of minimally invasive thermal ablation using transrectal ultrasound probes. Water-induced thermotherapy involves use of water at 60 degrees centigrade, circulated through intraprostatic balloon, and reportedly requires no anesthesia. Interstitial injection of ethanol or alcohol is a novel technique that has been revived recently, and clinical trials are planned. A large number of procedures imply that no one procedure is the best, and clinical judgment, available equipment, and the expertise dictate the type of treatment which is offered.